Weekend Clinic Lab Sofia 2 Flu COVID Combo Training. Here is the Sofia Flu COVID Antigen Box. On the outside you will see the expiration date and that QC has been done. These boxes need to be kept at room temperature. Inside the box there is the QC card as well as a positive and negative QC. Each box in the Weekend Clinic Lab is ready to go and QC has been done by the lab. Now we're going to talk about calibrating the Sofia 2 instrument. Here is the calibration log, and inside of this foil packet is the calibration cassette, which is to be protected from light, so does need to remain in this foil pouch when not in use. This can be found here in the top drawer in the Weekend Clinic Lab. To perform calibration on the Sofia 2, you will click the menu button and click Run Calibration. If you have not already, please type in your user ID and then you will insert the cassette into the device and press the play button. Slide it in and the Sofia 2 will do the rest. Calibration is required every 30 days of testing. On the screen you will see a green check mark, which indicates calibration passed. Now for patient testing, we will be using a foam-tipped swab, and we want to ensure that the swab does have 2 patient identifiers. And as a good practice, placing the patient label on the back side of the swab will allow you to know that you do have the appropriate swab. Here you will see the glass tube that is required to be used for the sample testing and can be found in the antigen Sofia box. Another thing to keep in mind, testing in the Weekend Clinic Lab does need to be performed behind a test shield with all the appropriate PPE on. Our next step is to add the solution to the vial, and doing this little flicking motion does ensure that all the liquid is in the bottom of this vial, so all of it can be expelled whenever you squeeze it into the test tube. Here you'll see me squeezing that a few times to ensure all liquid is in there. And now using our foam tip swab, we will insert it into the glass tube and being sure to tilt it a little bit on its side to ensure all of the tip of the swab is mixed into that liquid at least 3 times. Now we will set a 1-minute timer to allow that swab to incubate in the solution. And now, after the 1-minute incubation, we will be removing the swab from the liquid, but as you do that, you will want to roll that swab up the edge of the glass vial to ensure you are able to expel as much liquid as possible. And now the swab can be placed into biohazard waste. Next, you will get one of the test cassettes, which is located in the Sofia 2 kit box. This cassette is not able to have anything written on top of it, as it can interfere with the testing and cause your results to be invalid. Using the provided pipettes with the kit, and these pipettes do have 2 bulbs on them. The top one is to be used to squeeze the liquid up into the straw, and the lower one is used as an overflow chamber. Squeezing that to ensure liquid is all the way up the straw, and if some is in that overflow chamber, that is okay. You will expel all of that liquid from the straw into the cassette, trying not to allow any bubbles to get into the cassette as it can interfere with the migration of the liquid. This test has to set for at least 15 minutes and no more than 30 minutes. After the 15-minute timer, we are now ready to put the cassette into the instrument. Because we allowed the cassette to incubate on the countertop for 15 minutes, we will be running this in the Read Now mode on the instrument. When placing the cassette into the instrument, you want to be sure that you do place it with the arrows pointing towards the instrument. With the patient information already being inputted into the instrument, you will then slide in the cassette and press the play on the screen to allow the instrument to analyze your sample. This will only take about 10 to 11 seconds before a result is displayed on the screen. Here you can see that our result is negative. Now we are going to be talking about the walk-away mode. In this mode, the test setup is the same as what we did before. However, now the instrument is going to be doing the 15-minute incubation for us. It's just a matter of selecting the mode on the screen. You can see the timer has now been counted down from 15 minutes. After you get the patient result, you will be filling out a clinician copy result page and then putting results into the Weekend Clinic result book under the Flu COVID tab. This is a continuous result log, so there is no need to start a new page with each day of testing. You just put the patient results right underneath the previous one. Here you'll want to be sure to fill out all the blanks for the patient identification, and as well as the 3 results for your COVID, Flu A, and Flu B, and answering if QC passed or not. Be sure to throw away the glass testing tube into the sharps container when you are finished with the patient test. Sofia Flu COVID Combo Quick Overview. As a quick overview with this reference being posted in the Weekend Clinic lab, Step 1. You want to verify that the Sofia is in the Read Now mode. Step 2. Dispense all of the reagent into the test tube. Step 3. Place patient swab into the reagent test tube and roll the swab in the liquid at least 3 times and let it sit for 1 minute. Step 4. Remove the swab while rolling it against the side wall of the tube to remove as much liquid as possible. Step 5. Firmly squeeze the top of the pipette while the tip is in the patient liquid and release pressure so the liquid fills the straw. Step 6. Expel the filled pipette into the test cassette and let it sit for at least 15 minutes on the countertop and no more than 30 minutes.